Okay, my topic I chose is a disease called methemoglobinemia. I chose this because I saw a picture of one of these guys on the internet, and I was really curious about what was wrong with him because he's clearly blue, and they're referred to as blue people. All right, the disorder, this disease, what happens is there's an abnormal amount. An abnormal production of the amount of methemoglobin in the body. Methemoglobin is a form of hemoglobin, which is in your blood, your red blood cells. And it's basically almost like an iron deficiency, because what happens is the methemoglobin doesn't distribute. It's in a different form of iron in your blood, which the normal hemoglobin is in Fe2, which is the ferric state, and the ferrous state, and the methemoglobin is in the ferric state, Fe3. And the methemoglobin doesn't distribute oxygen to the tissues properly, so it messes up your body. There's two types. There's two big types, and they're branched off into categories. This disease can be inherited, which is the first kind, and both parents, the first kind of inherited, both parents carry the gene. They don't have to necessarily have the disease, but they both carry it. And in the first kind, there's a problem with the enzyme cytochrome B5 reductase. And this kind branches off into two different types. First type is when your red blood cells don't even have this enzyme. And the second type is when the enzyme just does not work at all. The second kind of inherited is called hemoglobin M disease, which only one parent has to carry the gene for it. And there's a defective hemoglobin protein, so it doesn't actually have to do with the methemoglobin. It's the hemoglobin protein is defective. Okay, and this disease can be acquired, which is the second kind. It could happen at any point throughout your life, just depending on what goes on. You could acquire it from certain chemicals, drugs, or foods, and anesthetics. Some people have gotten it from chemicals. Some people have gotten it from too little or too much anesthesia, or the way their body reacts to it. Same with nitrites, which is some in food, and antibiotics have affected some people. Symptoms of it: people have seizures, discoloring of the skin, which is usually blue. They have a lack of energy, fatigue, shortness of breath, and developmental delay, which is if they're young and they inherit it, then they develop, the developmental stages are off, I guess you would say. Okay, the way people find out about if you have it or not, you can do a simple blood test to see. I'm pretty sure it has to do with they'll be able to tell how much methemoglobin you produce, and if it's over the normal amount, then that's not how they tell. They have arterial blood gas tests. I don't know what that is, honestly. They have a pulse oximetry test, and just birth. If you inherit the disease, a lot of times the babies will come out blue, with blue skin. So the incidence, which is how often or how many cases. The hereditary kind is very rare. It's a rare disease. Getting it acquired is more common, just because there's more ways, with the food, the chemicals, and whatnot. And they've estimated it's about 100 cases per year, just based off of how many people have taken needed the medicine for it. And they're just estimating this because it could happen like I said, it could happen to anybody at any point in their life, so there's no really set time. Okay, this is the first guy that or the guy on my first slide. He acquired his because this is what he looked like before. Not sure how he acquired it, but yeah. And then this is just a picture of the methemoglobin and in the iron, the Fe3 state, and the hemoglobin in the Fe2. Facts about it: the type 1 and hemoglobin M disease, people with this usually do okay in life. They're usually alright, nothing really. They just do what they need to do to take care of themselves and they'll be alright. Type 2 is much more deadly because that's when the enzyme just doesn't work. That's when the enzyme doesn't work throughout your body. So it's more deadly. And the people that acquire it, they're fine once they start to avoid whatever caused them to acquire the disease. Treatments. This is the main treatment that people use. It's called methylene blue. This is how they determine the incidence of the disease, which is the 100 cases per year. They kind of determine it with how many people get this treatment. They have ascorbic acid, which reduces the amount of your methemoglobin. They have a hyperbaric oxygen therapy. You could get blood transfusions, which just would completely change your blood, and then not completely, but add new blood. And then for people with acquired, they just avoid the chemical, drug, or food. And that's it.